Hi, my name is Andrew Evans, and in this video, I'm going to continue my discussion of Derek Bolton's book, What is Mental Disorder? In this video, will be on chapter 4. Before I get started, I just want to note that section 4.3 of the book, or of the chapter, does have some descriptions of self harm. There's a case that Bolton talks about in which there's a self harming individual. So I just wanted to note that at the beginning in case you are reading the book. I won't be discussing this part of the book in this video, but I just want to let you know for reading. Okay, so I think what would be good is to start with where have we gotten so far in this book? So I'm going to review chapters 1 through 3 very briefly. So in chapter 1, Bolton discusses the main manuals for mental disorder, the ICD and the DSM. So the ICD is the World Health Organization's manual for diseases and illnesses in general, which has a section on mental disorders. The DSM is the American Psychiatric Association's manual for mental disorders. So he talks about them mostly in chapter 1. Chapter 2, he turns to talking about the sciences that are relevant to understanding mental disorder. And one thing he focuses on there is the concept of norms or normal, and how these different sciences sometimes have different concepts of what is normal. And in the last chapter, the chapter before this one, chapter 3, Bolton considers, quote, naturalistic approaches to mental disorder. So I'm going to go into a little bit what that means in this video, but he mainly focuses on the theories of Jerome Wakefield in that chapter, and he ultimately thinks that Wakefield's approach will not work. So that's what kind of prompts this fourth chapter, which is about taking a non-naturalistic approach to mental disorder. So if you remember from that video, he kind of lays out these two options. Option 1 is the naturalistic approach to mental disorder, which he thinks is characterized best by Wakefield. Mental disorders are grounded in harmful evolutionary dysfunctions. What's nice about the naturalistic approach, option 1, is that it grounds mental disorder in these scientific facts, but there's the drawback that it's not very clinically useful then, right? You can't really distinguish if someone has an evolutionary dysfunction from the clinic. Option 2 is taking a non-naturalistic approach to mental disorder. Here, Wakefield is wrong, and we just understand mental disorders as conditions that are distressing or cause impairment or disability. It's kind of how the DSM approaches things, though I will note that there's some disagreement on this. And what a benefit of this is that we can make those determinations in the clinic if someone is distressed. But a downside is that it's not grounded in scientific facts, right? It's not grounded in biological norms, it's grounded in social norms. So I also wanted to briefly review some of the other theories of mental disorder that I've discussed in other videos. So I have several other videos on different theories of mental disorder, but here's a brief overview of some of those theories because I want to be able to situate Bolton's account in relation to those other ones. Okay, so I think theories of mental disorder should be understood as either about biological norms, about social norms, or about both biological and social norms. So, what does that mean? So, what I mean by that is that mental disorder is normally seen as a deviation from some norm. And some people think that it's a deviation from some biological norm. And some people think that it's a deviation from a social norm. Some people want to combine the two. Okay, so this is how we can kind of understand these different theories. So, beginning with Saz kind of is a little bit of both. Well, he isn't in terms of mental disorder, but he thinks real disorders, physical disorders for him, those ones are biological, right? They are deviations from the structural or functional integrity of the human body. But he doesn't think mental disorders are real disorders because they're deviations from social norms. Okay. So, in a way, Saz is sort of on both sides of this. He thinks physical disorders are real disorders in terms of biological norms. It's just that what we call mental disorders are based on social norms. And for him, that means that mental illness is a myth, right? But not everyone agrees with that. Kendall is squarely on the biological side. He thinks that all disorder, mental and physical, involves biological disadvantage, and that that can be understood as increased mortality or decreased fertility. Sedgwick is on the complete social side of things. He thinks that all disorder, including mental disorder, is socially constructed, right? So really, Kendall and Sedgwick are like opposites. And they both disagree with Saz in different ways. Saz thinks that, physical disorders are biological, mental disorders are social. Kendall thinks all disorders are biological, and Sedgwick thinks all disorders are social. But of course, Sedgwick doesn't think that we should therefore not treat illnesses just because they are socially constructed. And this is another issue he has with Saz. Saz thinks because mental disorders are social, they shouldn't be treated medically, but Sedgwick disagrees. Okay. Wakefield, kind of in relation or in response to a lot of these older theories, comes up with a theory that mixes the two. So sometimes this is called a hybrid approach. For Wakefield, a mental disorder involves both biological dysfunction, which he grounds in evolutionary design, so it's an evolutionary dysfunction, and a mental disorder must also be harmful, and he understands harm in terms of social norms. So for Wakefield, a mental disorder involves both biological norms and social norms. The DSM definition of mental disorder is similar in that it talks about harm and dysfunction. It talks about an underlying dysfunction, and it says that mental disorders tend to be associated with distress or disability. But whether the DSM is actually a hybrid approach in this way, I think is a point of dispute. Wakefield certainly thinks that it should be. Bolton sort of disagrees and thinks that the DSM is more about social norms than anything. But for now, I'm just going to characterize the DSM definition as being a hybrid like Wakefield's. It involves both considerations of biological dysfunction and social norms about harm. So now that we have these on the table, I'm going to move to talking about Bolton's conception and how it kind of relates to these others. But before I do that, I just want to note that there is another term that's sometimes used for these two different sides: naturalism and normativism. So the theories that ground disorder in biological norms is often referred to as naturalism, and the theories that ground mental disorder in social norms is often referred to as normativism. And like I mentioned briefly, theories that combine the two are often called hybrid theories. Okay, now moving on to Bolton. He wants to give a non naturalistic account of mental disorder. So, just to go back here briefly, if the left side is naturalism, he wants to be on the right side. He wants to give a normativist or a non naturalistic account of mental disorder. So, he wants to choose this second option, right? He thinks that Wakefield is wrong and that mental disorders are simply conditions that mental health care treats that cause distress, disability, and he'll fall on this end of the diagram here, right? He'll be similar to Sedgwick in a way, in that he wants to ground. He only thinks mental disorder can be grounded in social norms. Okay, so he begins the chapter 4, by talking about the DSM definition of mental disorder. So I sort of mentioned this a little bit. I think that Bolton would disagree with Wakefield and thinks that the DSM definition of mental disorder is much more on the social norms side of things, whereas Wakefield thinks it's more of an actual hybrid approach. Bolton talks about how the DSM definition of mental disorder came about. Why was it created, and how was it created? So he talks about how in the 1970s psychiatry was criticized by gay rights activists because homosexuality was listed in the DSM as a mental disorder. So this prompted the creators of the DSM to consider, well, what is a mental disorder? Because up until DSM 3, there was no definition of mental disorder in the DSM. So the creators of DSM 3 looked to the conditions in DSM 2 to come up with a definition of mental disorder, and they decided that mental disorders reflect an underlying dysfunction and tend to involve distress, disability, or disadvantage. So they used that new definition of mental disorder to then exclude homosexuality as a mental disorder eventually, because they reasoned, homosexuality in itself doesn't cause distress, right? It's only distressing if a homosexual person is living in a homophobic environment. Okay, so this is a quote from Bolton. He says, quote, Spitzer reviewed the characteristics of various mental disorders in the DSM-2, taking for granted we may suppose that that is what they were, and concluded that it was it was because of the problems they caused that they had been included in the diagnostic manuals. This seems to me like the right conclusion. Emphasis on the harm-driven characterization of the mental disorders hangs together with the question of how conditions come to be included in or excluded from the diagnostic manuals. The conditions in the manuals are, generally speaking, the ones people have brought to the clinic. So what Bolton is saying here is that he agrees with the DSM's approach, that what really makes up a mental disorder is the fact that it causes distress and disability. It causes harm. And so he's really grounding his thinking about mental disorder in the consequences of mental disorder, not like what the actual disorder is or where it comes from. The fact that it causes harm, that harm is a consequence of mental disorder. For him, he thinks that that's what mental disorder is all about. And he thinks that that's what the creators of DSM-3 were also getting at when they came up with their definition of mental disorder. In other words, Bolton agrees with the DSM that what makes something a mental disorder is that it causes harm, distress, or disability, and that is what people tend to seek out treatment for. So he's thinking about both harm and also this idea of what do people actually seek out treatment for? They tend to seek out treatment for harm. So let's apply this to an example. So we suppose we have this person and they're very obsessive, right? Maybe they meet the criterion for obsessive compulsive disorder. They can't control their thinking and they need to perform certain behaviors in order to lessen their anxiety and their obsessive thinking. Now, for Bolton and for the DSM, or at least Bolton's interpretation of the DSM, um, this person would likely be distressed, right? And there would be some impairment or disability related to their condition. And this is the sort of thing that people bring into the clinic, right? They're struggling, they're suffering. So they come to the clinic to seek out some help. Bolton thinks this is kind of the domain of mental health care. This is what we're doing when we're treating mental health conditions. We're treating those conditions that people are distressed by and that they want help for. Okay, so Bolton gives an explicitly non-naturalistic approach to defining mental disorder, and it's inspired to some extent by this DSM definition. And so this is mostly given in section 4.2. He gives several bullet points in that section. I only talk about a few here because this video in general doesn't really talk about everything Bolton talks about in chapter 4. He talks about like disruption of meaningful connections. He has a whole section on Foucault and postmodernism. I don't really focus on those parts because I think that these other parts that I am focused on relate more to some of the other videos I've posted. So that's just a note, I'm also not talking about all the bullet points that he lists at the beginning of section 4.2. I'm just focusing on the relevant parts for our discussion. So he explains that we should understand mental disorders as existing in the clinical presentation or in the person's lived experiences. What does that mean? It means that the mental disorder is right there in the experience of it. It's not some underlying thing necessarily, or at least we don't need to look to the underlying thing to determine that it's a mental disorder. It's right there, right? And it's right there because it involves distress and disability. It's right there in the person's experiences. Also, mental disorders do have to do with dysfunction, right? The term mental disorder implies dysfunction, but we can't ground dysfunction in scientific biological norms like Wakefield or Bourse or Kendall did. He thinks that the dysfunction that's present can only be understood in terms of individual or social norms. Okay, so let's apply this non-naturalistic approach to defining mental disorder to this case. So this person is having lots of obsessive thoughts, having difficulty controlling their compulsive behaviors, let's say. So this, for Bolton, he would say that the condition itself is right there in their experience, right? It's because it's a distressing and disabling experience that makes it a mental disorder in the first place. So he's not referring to some sort of underlying biological dysfunction. He's saying that it's right there when this person comes to the clinic. It is the obsessions themselves, the experience and the pain that are involved in going through this that makes it a mental disorder. And we might still say that this person is dysfunctional or has some sort of impairment, but we shouldn't think about that dysfunction as necessarily being grounded in brain chemistry or evolutionary design or biological fitness. We should understand their dysfunction as being grounded in individual or social norms. This person isn't functioning the way they want to be functioning, or they're not functioning the way society expects them to be functioning, right? Um, so that is the sense of dysfunction that Bolton thinks is relevant to mental disorder. Okay, so that's why we can put Bolton here on the social norms side of things. For Bolton, a mental disorder involves dysfunction, but that's according to individual or social norms, not biological norms. And a big part of disorder for Bolton is that it involves distress and or disability. Okay, so I want to conclude with a later part of Bolton's chapter where he talks about what this means for the domain of healthcare. And when we say the domain of healthcare, we sort of mean like what should the healthcare community be doing? What sorts of conditions should the mental health or should healthcare in general, medicine in general, be treating? But really, he is focused on mental health care in particular. So we can kind of just think of this as the domain of mental health care. What is the appropriate goals of mental health care? What are the conditions that mental health care should be treating? Okay, so now that Bolton has said that we cannot ground mental disorder in biological norms, he has to explain how we know whether or not a condition is appropriate for mental health treatment. And here he says, quote, "The suggestion in brief is that this domain is defined fundamentally by a distinctive kind of problem or a kind of response to problems rather than by a distinctive kind of problem." He goes on to say, quote, "Is this not circular, defining the medical domain in terms of what physicians do? No, because the purpose here is to define one kind of response to human complaints of suffering among other possible ones." So, what is Bolton saying here? He's saying that the domain of healthcare doesn't need to be defined by the types of conditions that healthcare treats. Really, the domain is defined by the sorts of interventions that healthcare does, right? Um, Physicians, therapists, social workers, nurses, they have a particular way of responding to suffering, and that is what healthcare is about. And the only thing that the different conditions they respond to have in common is that they're distressing, they're disabling, they're harmful. So this is another similar point Bolton makes. He says, quote, "My suggestion is that what is distinctive about the medical or healthcare domain is not the kind of problem, some kind to be kept distinct from social problems or ordinary problems in living, but is a particular kind of response characterized by seeking to respond to requests for help at the individual level using the available sciences of body and mind." So, what's happening here is in healthcare and in mental health care in particular, people are bringing conditions that are causing them distress, that are causing them suffering. And mental health care responds in a particular sort of way. It responds in an individual way. All right. So therapists generally don't respond by, or at least not mainly, by trying to change society or change, laws or oppressive structures. Right. They respond to the individual because that is their role. It's an individual response. It's one on one, and they also use the available sciences of body and mind to respond. So, what Bolton is getting at here is that conditions that cause suffering, um, there can be lots of different sorts of responses, right? There could be socio political responses, there could be religious responses, cultural responses. But what mental health care is doing is an individual response, focusing on the individual through therapy, through medication, right? And using the sciences of the mind and body. But that's just one particular kind of response to suffering, and there are others. Okay. So, for example, if we think of this person who's having obsessive thoughts and compulsive behaviors, mental health care would likely respond by asking them about their experiences, by trying to understand their patterns of thinking and trying to intervene maybe on their patterns of thinking and their behaviors. There are other ways, maybe, that we could respond to this person's suffering. Maybe there are social changes that can be made or political changes that can be made that would reduce this person's suffering. But the response of mental health care, so the response of this therapist, doesn't really involve that because the role of mental health care is about responding to this particular individual and their particular ways of changing on their own. Okay, just to summarize what we've gone over in this video, after having rejected naturalistic approaches to defining mental disorder in Chapter 3, in Chapter 4, Bolton gives a non naturalistic approach. For him, we can understand mental disorders as mostly being about distress or disability, and any notion of dysfunction that's attached to them must be grounded in individual or social norms. They can't be grounded in biological norms. Therefore, mental health care is about treating distressing and disabling conditions, but it's just one type of response. It's a response that's focused on the individual and it uses the available sciences of mind and body. All right, so I'll just end with this brief writing exercise. I want you to spend some time thinking over these questions, maybe pause the video, think about these questions for a bit, and then spend a few minutes writing out some answers. The first question: of the different approaches to mental disorder discussed in this video, which do you think is closest to being correct? And then how would you define mental disorder? So we've gone over a lot of different approaches to defining mental disorder. I've gone over it in other videos, and also I've summarized the different positions in this video. Do you think any of them are correct? Or do you think that there's a better definition of mental disorder? How would you personally approach conceptualizing what mental disorder means? And then also, what do you think of Bolton's take on the domain of mental health care? Do you think he's right? Or do you think that the domain of mental health care should be understood differently? All right, well, that is all I have for this video. Thank you for watching.